Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, guys. Welcome back. We're so glad you're here today. So today we're talking about an issue that kind of intermingles with all of our homes. It's constipation. And we have a pediatrician, Dr. Aundria Speropoulos, who has been in practice for over 19 years, who is going to talk to us and break down this issue. She also is the mom of 5, and she's one of the founding partners of Leeward Pediatrics, a pediatric group in Kansas City. And I think, something I really appreciate about Dr. Speropoulos is that she is a great diagnostician. She does a really good job at listening to all the information, slowing down to hear what her patients are saying. So she is going to present to us some of the things that she talks to her patients about in terms of constipation. So with that, let's get to Aundria.
Thank you for having me.
Yes. Okay. So let's get to it. So what is constipation? How does it look? How do healthy stools look? What should we know?
Yeah. So constipation, again, so common. And I'm glad you asked me to talk about this. And I thought, yes, so many parents bring their kids in. Most of the time they bring them in for kind of abdominal pain. They don't really know why, because as your kids get to be older, you don't know what they're doing in the bathroom all the time, right? So often constipation will look like abdominal pain. That's usually what parents know. Let's start with that. So usually most parents will just see his tummy hurts. He says his tummy hurts. That's all I know. Now, what true constipation is the definition of it is less than 2 stools a week. That's not very much. Or hard to push out stools or very large diameter stools. That's the definition of constipation. But often what we see as parents or as pediatricians is just pain. It just hurts. That's typically what we introduce it as.
Yeah. And so, as parents, we're seeing that our kids are complaining about tummy aches and maybe they're not stooling as often. And like you said, we're not often in the bathroom with them. The only person in my house, the 2-year-old's the only one I'm aware of stooling, right? Otherwise, everybody's kind of doing their own thing. And so what should we, if we do see our kids' stools, like what should they be looking like? Like what does a healthy stool look like?
I don't know if you've ever heard of it, but one of the things that we like to talk about in the office is the Bristol stool chart. Have you ever heard of this?
Yes.
We love it. I love it. I know it's silly. All of my kids love it when I pull it up and they start to giggle, and it kind of just like softens the discussion about stool and makes it okay. Like we do need to talk about this. The old book of everybody poops. Is it true? Because not everybody does poop. And so showing them the stool chart is really good. So I recommend all of the listeners just look at that so they can kind of see what's healthy. But a good stool is a Bristol stool, 3, 4, or 5. So in general, you want it to be like a 4. So a longer stool, smooth, not broken up in chunks necessarily, not a thick diameter or a thin ribbon. It should be just kind of a long, comfortable, smooth stool. That would be the goal. Or a little softer than that is perfectly fine too.
Yeah. Because if it gets hard, it hurts. And so our kids can complain about that too.
Mm-hmm.
Yeah.
Yes. Which leads to more withholding and more constipation. So yes.
Yeah. It's a vicious cycle, right? So if we don't break it, then it's like nobody wants to poop when it hurts. And then we're like, I'm not going to the bathroom. I'm just going to hold it. And then it's harder and harder to get out. So why does it happen? Why do we get constipated, or why do kids get constipated?
There's a few main times in kids' lives that we know that it happens. So these are fairly typically when they happen. So the first one that we encounter is the introduction to solid foods or the introduction to cow's milk. Very common. We see that all the time. There's a little less liquid going in. Cow's milk in itself can have a little bit of sensitivity with most people and can kind of thicken stool, slow stool. Younger kids aren't always getting all the fiber and the sorbitol of the fruit that they need to poop. And so that's one common time. The next time you encounter is when you toilet train, right? And you've done that many a time, so you know that too. So there's a control issue there slightly. Sometimes they have a stool and it hurts. Then they start to withhold. So the toilet training is the second most common time that we see, or the second time in their life that we see. School age is a very common time that we see. They don't want to poop in public. They don't want to stool at school. The teachers are rushing them, or the bells are rushing them. So it's stressful. It gets hard. Those are the developmental stages that typically happen around the constipation. Of course, we'll see it with travel, life stressors, those kind of things too. But developmentally, that's when it commonly happens.
Yeah. Well, and sometimes pooping can take a while, right? Like it can take time. And so if you're not able to like sit down, like at school, for instance, you don't have the time to like relax and those kind of things. And it does make it hard to want to go to the bathroom, but also poop is kind of stinky. So you don't want to do it at school and you don't want people saying things. And that can be a deterrent for kids too.
I know. One of, we can go through recommendations on how to kind of encourage your kids to stool. But one of the things that I think is really good is your body naturally wants to stool once the intestine starts to contract about 30 minutes after you eat. So a really good thing that parents can get into early on is getting their kids up early enough to eat a breakfast, not rush them, see if they'll stool after breakfast before the day starts. Wonderful. Or they get them home from school, give them a snack. Hopefully we have enough time before practices and everything else to get a stool in, or after dinner. So trying to just be mindful of timing and when I'm feeding the kid and when I'm rushing him is really helpful to them too.
So, I mean, that brings me to wonder, like, what's the ideal amount of frequency of stooling? Like when or how often do kids or adults?
So you don't have to. Ideally, it would be more than twice a week. So obviously, most of us think that we need one good stool a day or one good stool every other day. And that is what we're looking for comfort. But if a child has a stool 2 to 3 times a week, they're smooth, they're easy to push out, they're not painful, then that kid is actually considered just fine. So just because we deem it as a parent worrisome because it's not more frequent, there's nothing wrong with that. The kid is comfortable, the stool looks soft, the child feels fine. So 2 to 3 or more or daily is great.
Okay. So yeah, that 2 times a week you said is kind of when we're saying constipation is the definition potentially if they're also having discomfort.
Correct.
Yeah. Okay. So how do you know if your child is constipated? Like we said, we're not really looking at their stools, so it's hard to know, but what would we know?
So if you have a child with abdominal pain, my kid is saying my belly hurts, still playing, still going to school, nothing seemed to be different. I'm not overly worried, but it's starting to kind of spark my radar. Start paying attention. Ask them to not flush the toilet when they're done. Could you just not flush? You can leave. You don't need to be embarrassed. I just want to go look at your stool and take a look at it. Then kind of look at that Bristol stool chart, see if it's hard balls, see if it's a large diameter stool or hopefully not any blood in the stool. So first look at it, pay attention how often they're in there and how long they're in there. Are they those poor little guys in there 30 minutes and pushing for one hard stool or one little ball? That's worrisome. We need to deal with that. So timing, take a look at it. It's your kid. You've looked at their stool for many years. That's perfectly fine. And then are they starting to have some secondary issues? Are they not wanting to eat as much? Is it waking them up a little bit at night and in the morning and they're grumbling about it? Do they want to go to the bathroom more frequently, but nothing's really happening? So those are typically what a parent would see at home.
Yeah. So, and we kind of said constipation can present as other symptoms. What do you think we should be keeping in mind? And like, when do we start working with our pediatrician on this? Like, when does it meet the threshold of like, hey, let's get some secondary help on this?
So if you ever don't know and the child is in severe pain, there's blood, you see blood, the belly looks big and distended, I would just go right away, either to the ER or to the pediatrician. Just go get it checked out. You don't need to wait time. Now, if it was the first scenario we just talked about and it was kind of more slow evolving over the course of weeks, then you decide that you think the child's constipated. You could start working on a treatment plan, which we can talk about. And then if it doesn't work with home remedies within 2 weeks and or things get worse, then you need to start talking to your pediatrician.
Okay. So what are those things? How do we manage the constipation, or what can we do to just help our kids? Maybe our kids aren't constipated, but have slower stools or something. Like, how do we manage that piece, or having a healthy diet? So let's start with, how do you manage constipation?
So without medication, just at home, what you can start with is obviously optimizing their water. Most of our kids don't drink enough water. Most of us as adults don't drink enough water. So optimize their water. 2 to 4-year-olds can drink 3 to 4 cups a day, 4 to 8-year-olds, 5 to 6 cups a day. Anybody over 8 can really drink 7 or 8 cups of water a day, just like you and I can, and do just fine. So optimize water is number one. Optimize fiber, but you don't need to be excessive. I see a lot of parents who want to go buy fiber supplements. Anything that you can ingest by food is better. So if we can just optimize our food nutrition with fiber, that's even better. So peas have fiber in them. Multigrain cereal like Cheerios has fiber in them. Whole wheat foods have fiber in them. So looking for fiber, most school age kids need about 10 grams of fiber a day, something like that. We don't need to go crazy with fiber, but make sure they have fiber in their diet. So water, fiber, work on that toilet time that I talked about, not rushing them, making sure they have time to sit in the potty. They don't have to push hard, just sit in there. With the young children, I always try to encourage parents to make sure the kids have something to put their feet on. If you're putting a little person on a big potty, he doesn't have anywhere to put his feet. So the little potties can help, or the little squatty potties or something for them to put their feet on a stool, just to have that kind of positioning of the rectum and the feet help quite a bit. That's the typical recommendations for home. Get that going, see if that starts to work on it. Increase fruit, vegetables, water, which has the fiber in it. Work on the toilet time. And that's usually where you can get things to start to move a little bit more.
Yeah. Well, and one trick in my practice, I see a lot of kids that are constipated, and it can sometimes become a behavioral thing because they are withholding because it is painful. And so trying to like get their mind around that, or they might be anxious around that. And something I found a nutritionist or a dietitian actually had recommended was having them do uncaffeinated tea, because it's kind of like fun, and it's like something that increases water and it's warm, and they generally like that. Are there things like, is taking a bath something that's helpful? I asked that because I know that I've had kids that earlier in life that have pooped in the bathtub, and I'm like, oh, okay, right? So
well, they're relaxed. And so mom's not rushing them. Yes. So I feel like the life that we now all lead is just fast. And so trying to make sure you take the time. Don't let Johnny wake up right at 7 when he has to leave at 7:15 for school. Get him up early, make a really enjoyable morning, make it easier for him to wake up slowly and get some food in him. Then he may take the time and sit for 10 minutes on the potty and have more time to go. So it's the relaxation. The warm water is mostly just kind of relaxing, can help relax the rectum, but the kid is relaxing.
yeah, that makes sense, is that it just gives them the opportunity, because sometimes sitting on the potty may not be that relaxing. But if you make it part of a habit, that makes sense why it's just like something normal that they would do. Okay, so we talked about managing it. Obviously, pediatricians are going to have some other strategies if you get into their office to manage. But do you find that most kids can manage stool and constipation at home, or do you feel like a lot of them need pediatrician intervention, or how do you find that goes?
Well, when it comes to us, obviously that's more what we see. So I would say often most of us, we truly see abdominal pain. And I don't have hard numbers on it, but I would estimate somewhere between 80 to 90% of the abdominal pain we see is constipation. Can definitely be more severe, worrisome things, and you have to work through those to make sure it's not that. But by the time it's gotten to us, parents have usually worked on water, worked on some food choices if the kids will accept it. So I would say a small number of parents can actually get through it on their own. They need a kid who's very willing to eat what they ask them to eat, very compliant and listening to what they say. Sometimes just going to the doctor helps the child know it's just a little bit more worrisome and serious, and we do have to do these things that mom's telling you to do, which are healthy. So I don't know that I have a percentage for you, but I would say that's at least greater than half probably need to end up at the pediatrician. If you cannot fix it, you need to go.
Yeah, that seems good. And also, I think, something I noticed is also movement. That helps with stooling too, is like getting movement in. And a lot of times I find that our kids are now wanting to come home from school and just like sit. And that part is also negatively impacting how we're having movement in our colons. And so then that can make it harder.
And that goes hand in hand with, processed carbs and white sugars, and just not getting the fiber and the wheat that we need in our diet, and moving our bodies, and then desiring water, all of the above, that just leads to like a healthy body, which was designed to function that way.
Yeah. I mean, when we think about it as like hunter gatherers, like long time ago, I mean, it wasn't that long, but it was a long time ago, that's what we did. We just like walked around and we ate was on the land, and there's no such thing as Cheez-Its or goldfish crackers. Although they may be delicious, those things didn't exist. And so then we had more whole foods. So our body seems to be more designed to tolerate that kind of caretaking of it, right? More water, more fruits and vegetables, and also movement.
Eat natural things and then function naturally. And then we intervene with, modern foods and modern technology that changes our habits, and not always for the better, as we all know.
Yeah, absolutely. Okay. So what do you want parents to take away from this conversation about constipation? What do you want them to remember?
My biggest key that I try, which I like to be more preventative, because again, we have medicines we can use to fix it, and we can fix this. This does not have to be a miserable, uncomfortable problem. So we can fix it. But the conversation I like to have early on with families when I get them young is a lot of it can be prevented. And so working on like a good diet early on, introducing fruits and vegetables and making it part of a habit of breakfast, lunch, and dinner has fruits and vegetables in it. The child only drinks water with milk, small amount of milk at meals is a really healthy, very easy habit to introduce from the beginning. I think it's very good just to stay positive about stool. We don't have to, it doesn't have to be stinky and yucky, and we don't have to make it a negative thing. Great job, good job. I'm glad you feel better. Let's go play. That's so good. Now we can go outside. Not rushing them to potty train, not rushing them out of the bathroom, taking the time. So really the prevention is the biggest key. And then I always want parents to think about when their child's having abdominal pain, that this could be this, if the child seems comfortable and this doesn't seem like an emergency, let's start with constipation and evaluate their stools. Could be right, could be wrong, but certainly something that a parent can start working on at home before they spend the time and the money and the missed work to come to the office. It's worth your effort to try.
Yeah, that makes sense. And I love the idea of just giving our kids time and making it part of like a healthy routine. Because I think although there are some kids that are picky eaters for other reasons, and we know that toddlers can go through that stage of eating everything and then all of a sudden not, it does make sense to create a habit around that. And that helps just for lifelong. So my last question is, what do men do in the bathroom for so long?
I don't know. I don't
Yeah,
know. I think they
I'm still
hide from.
trying to figure.
I think they hide from us and the kids. It's what they do. I
I'm
know.
still trying to figure it out. I love my husband, but I'm like, how does it take so long? And I always have visitors when I go to the bathroom. It doesn't matter what I'm doing in there.
Yeah.
They like it's
Animals,
like
children. Yes.
yes,
Mhm.
and knocking on
Yes.
the door, even when my 12-year-old is like needing something, I'm like, can I go to the bathroom in privacy, please? It's like,
Mhm.
well, I just needed to tell you this thing. And I'm like, that has nothing to do with what I'm doing, right?
Yes. Truly, moms should probably have the biggest level of constipation because of our habits and our rushing. So yes, I would completely agree.
Oh, goodness. Well, thank you so much for coming on and talking to us about this day today. It's been so informative and helpful to just like get a healthy perspective on constipation and how to manage it at home and when to reach out to get additional support. So thank you so much for your time.
Thank you for having me.
Thanks again, Andrea. That was great information. I really appreciate you breaking that down for us. I think a few takeaways were just being aware of our kids' water consumption, our kids' activity level, our kids' fiber intake, and just giving them time, which is something as a mom that we don't really think a lot of. It's like hurry to this and hurry to that. And so like giving our kids time to stool, that's something that's great advice. And I think, I am going to be more conscious of that in my own home. I think also just like keeping in mind if things have lasted, if your kid is having really bad tummy pain, then go to the emergency room or see your pediatrician right away. But if it's something that is just like uncomfortable, but they're able to do the activities to kind of go through this process and see if there's something that you can adapt that would make this easier. And maybe it's also just having a conversation with them about this. Like, I wonder if your tummy pain could be because of not getting all the poop out. Like that could be something, and talking to them about how healthy it is and how good it is for their body, that when we're eating, we also need a stool. I think those conversations are important. And then the more that we educate them, the more that they're going to be willing to kind of sit down and do that, knowing what the key components are. And maybe you could track it. Maybe you could have a water chart of how much water they're drinking, about the healthy foods they're eating, about doing physical activity, and that it's just like something where you're celebrating keeping and taking care of our amazing bodies. And then finally, I love this idea of just introducing this stooling part early in life, especially around the potty training, not putting so much pressure on our kids. And that can create a healthy relationship with being able to stool as an older kid. I think that's great advice too. And I know that sometimes we can't go back in time. So where we are is where we are. But to all those toddler parents out there listening, that is great advice for them. With that, I'll say thank you so much for your time today. If you like what we're doing, please share us with your friends, subscribe to our show, and give us a rating. We would love it. Also, keep up the emails with your questions and also topic requests to accidentalexperts@gmail.com, and follow us on Facebook, YouTube, and Instagram. With that, I'll say thank you. Have a great day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.